Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. We'll start today's show with a quick look at the COVID-19 statistics for the area. In the city and county of Peterborough, Hiawatha and Curve Lake First Nations, 67 confirmed positive cases, more than 4,800 individuals tested, 2 deaths. 49 of those 67 confirmed positive cases have been resolved, and there are 3 current local institutional outbreaks. In the city of Kawartha Lakes, 134 confirmed cases, 14 current high-risk contacts, 8 hospitalizations. 103 of those 134 confirmed cases have been resolved, and 32 confirmed deaths as part of 4 confirmed outbreaks. In Northumberland, the number has jumped from 13 to 14 for the first time in what seems like weeks. Probable cases at 0 current high-risk contacts, 9, 1 hospitalization, and 13 resolved cases. Peterborough-Kawartha MPP Dave Smith shines more light on the opening of the economy, what could happen if we open too soon, and also states the Government of Ontario does not have the power to stop people from going to their summer homes, but urges residents to avoid travel. If they do, to make sure that they maintain proper physical distancing and to keep doing what we have been doing to stop the spread.
Yesterday, Premier Ford met with mayors in various cottage countries across all of Ontario. Locally, Warden Jones, Mayor Mitchell, and Mayor Amiot were part of that call. And we talked about how the province should proceed as we open up the economy from COVID-19. And specifically, what we should be doing with secondary residences for people. Premier is been pretty adamant that we want to keep the concept of if you don't need to travel, please don't travel. Stay at home unless you need to go someplace. But he also recognizes that it's not possible for him to pass legislation that says you cannot travel someplace in Ontario. Travel restrictions like that fall in the federal jurisdiction, not in the provincial jurisdiction. We know that people who are going up to secondary residences, people who are vacationing in areas like ours, contribute a great deal to the domestic product for our area. But we also have to recognize that we're still fighting a pandemic virus. And the health and safety of people in Ontario should always be at the forefront. The most important thing that we do as we open up the province is making sure that we don't have a secondary wave of this disease. It takes 2 weeks for the virus to incubate and become evident for most people. The changes that we make today, we're not going to see the effects of it for 2 weeks. If we open things up too soon, if we do things in the wrong speed, then we'll be in a position again where we have to enter a form of a lockdown. 1 day too soon means 2 weeks of a lockdown. So we have to get this right. We have to do it in a staged manner, and we have to make sure that the people recognize that although you are able to go out, although the weather is nice, you still have to have your social distancing. You still have to maintain all of those protective measures that you've been taking. Don't let all of the good work that you've done go to waste by doing too much too soon. Along those same lines, we are opening up more businesses in Ontario. And I'm going to start with garden centers and nurseries. They will be allowed to open for customers to come in as of Friday night. We started off with curbside delivery with it. We had a number of people who were coming to it. That has been done safely. The nurseries and the garden centers have been able to put in place measures to protect the public as they come in and shop. Now they're ready to open. On Saturday, that'll extend to hardware stores and safety supply stores. Again, they have been doing curbside pickup up until now, and it's given them the opportunity to put measures in place to protect people from the spread of the disease as they move into the store itself. I know for a lot of those businesses that's welcome news, but again, it comes back to they've done the right things to make sure that people are protected and that we're not going to be spreading the disease. On Monday, we'll open it up for curbside delivery for all other retail businesses who have a storefront. Again, it's staged that way to make sure that everything can be put in place to protect both the employees and the customers and not spread the disease. And the last thing I want to talk about today is hydro rates. We have extended the time of use rates at the lowest level until the end of May. We know that there are still a large number of people who are working from home. There are a large number of people who are still out of work because of what's happened with COVID-19. And it's not fair to punish them by having their electrical rates be the peak rates in the time where they're at home and they don't have any choice but be at home. So we're extending it again until May 31st. Then we'll enter a COVID recovery phase from there. Hopefully, we're in a position that we are moving out of COVID-19, moving out of the pandemic phase of it, and we're back into a recovery phase on things. I can't thank the people of Ontario, especially the people of this area, enough. If you look at the number of infections that we've had and the number of deaths in our area specifically to COVID-19, we have done a fabulous job. When you look at the rest of the province, we have done extremely well here. And it's because people have been following the guidelines. Let's keep that up. The sooner that we beat this virus, the sooner we can open Ontario back up. And the more people stay with the social distancing, the more washing of your hands, protecting others, and not putting yourself in a position where you have an opportunity to contract the disease or spread the disease, the more we do that, the sooner we'll be able to open Ontario back up.
Premier Doug Ford announced today hospitals will soon reopen for non-COVID-19 related surgeries.
Today's news is an important step forward. We're telling the hospitals to get ready. We're telling patients to get ready. And we're hopeful many of these scheduled surgeries can start soon. I know the delays have led to anxiety and stress, but I hope today can help ease some concerns. To those waiting, we're here for you. Help is on the way. Thank you, and God bless the people of Ontario.
Being a mayor is no easy task. Factor in a pandemic and it's not something many people would be prepared for. Kawartha Lakes Mayor Andy Letham reflects on the challenges he's had to face.
I think the hardest thing, that I'll go back to was, really the tragedy at Pinecrest, just that helplessness that, this sort of came out of nowhere, this pandemic, and nobody really knew how bad it was going to get, where it was going to go. We had people dying every single day in this home. We really couldn't do a whole lot to stop it. It was a private home, for one thing. And the province was involved to try and help them out. And it was a real crappy feeling, for lack of a better word, to just, I can't do anything, but I feel I have to be doing something. And it was hard. It was probably, if I look back over my 8 years, when that 8 years is up, and say, what was the hardest part? It had to be that 3-4 weeks, going through that Pinecrest situation where we couldn't do anything for those residents and their families. And it was heartbreaking, and it was a tragedy. And I'm glad it's slowed down and doesn't do anything to bring those people back, obviously. But, it was a tough slog. It was a tough slog for a lot of people. And I think I'll look back on that as one of the obviously the low points in what our whole community's gone through. And hopefully we got better times ahead.
Adjustments have been made by everyone at home, and we've had to change the way we produce television here at Your TV. Currently operating out of the studio here on Goodfellow Road are myself, another producer, John Costello, and our manager, David Feely. Currently working from home, but providing segments for the COVID-19 Local Impact Show are Mark Rockburn, Marcus Ferguson, and Mary Tendeshat. We speak with Mary about the new world of television production.
At the beginning of the pandemic, when I started working from home, I wasn't producing my normal shows, politically speaking, Peterborough Matters, Queen's Park Report, the Ottawa Report. We were just doing our local update. So I was just doing interviews through Zoom. I have a background in TV journalism, so that wasn't too difficult. Just recently, we started bringing those shows back. When I'm communicating with a host in the studio, he's wearing an earpiece and I'm speaking to him through a microphone. So he can hear all my direction when it's time to go to break, when we have 5 minutes left in the show, when it's time to wrap it up. Any other direction that I want to give him, he can see, he can hear through his ear. But in the Zoom world, I don't want to be part of the interview. So you can't see me, and I can't all of a sudden talk in the middle of the interview. So what I'm having to do now is, when I'm not giving direction, I close off my camera and you can see the background behind me. I will go into speaker view when I need to actually speak to the host. I'll open up my camera and then I'll give them the signals like 5, 4, 3, or wrap it up, or anything like that. So all the signals are actually having to be done visually. And then I have to close up my camera again and make sure that I don't take the gallery shot, which would show me on air because I'm not part of the show. So that is a big change actually through Zoom. And it took a little bit of figuring out how I was going to logistically be able to effectively direct a show.
Maybe more important than the ability to technically produce the show is ensuring the content is informative for viewers. And Mary is getting information from people in the know.
In this COVID ever-changing world, there's always something to talk about. You can even compare what happened a few days ago to what's happening now. So the content is really rich. And during this pandemic, we all want to be informed. And I feel like the people that I'm talking to, whether it be the mayor, the MP, the MPP, people in our community, really have a lot of information to share. So I think the information for the viewer is very rich during this pandemic, and very informative.
With all that being said, the convenience of Zoom is nice, but there's something missing from your TV productions.
During National Volunteer Week, when we were actually able to touch base with our volunteers and find out what they're doing, it really made me miss them even more, just because we have that team environment when we're in the studio together. And when it's just like we're a mini family. And right now, I don't have that family. I'm all by myself. And it'd be nice if the volunteers were able to be back in the studio with us, you know, doing camera, doing lights, doing audio, directing the show. It's just more of a family atmosphere rather than doing everything by yourself.
We'll continue to provide as much local coverage as we can going forward on your TV. As COVID-19 local impact continues, we'll get an update from Northumberland, and with church revenues dropping, we find out how this is impacting the local churches. Welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. On Monday, Premier Doug Ford announced communities are able to allow groups to start working in community gardens. The town of Cobourg acted quickly. Earlier this week, it was announced the Cobourg Community Garden in James Tracy Park is officially open.
Premier Ford decided with negotiations with the public health medical officer to give us the opportunity to open up community gardens in Ontario. I know we have the Tracy Park, I call them community gardeners, who were chomping at the bit to get going. The really good news, we did the photo op the other day, is that all their beds, and they've expanded within the past year, have all been spoken for. So the good news, it will give those who love to garden an opportunity to get a mental release. It also gives them an opportunity to produce food of high quality. And I know they also share that with different groups, including the food bank, through the year. So my answer is it's a win-win situation for everybody within the town of Cobourg. And my hope is on council, I can encourage other councillors to consider perhaps other plots of land for more community gardens, because I think that's the direction we're going. I've spoken to so many people independently who are starting to create their own independent beds in their own backyards.
So John, obviously there's going to have to be restrictions put in place. What are they that they must follow?
Oh, well, the list is quite extensive. One thing I give Premier Ford, he's done the balance. He's allowed you to open the community gardens, but at the same time really enact very strict guidelines for the gardens. They're quite extensive. More importantly, I'm pleased that the Halliburton, Kawartha, Pine Ridge District Health Unit review guidelines in alignment with the province, in alignment with Durham Region, and created their own. And I've shared those with the Tracy Community Gardens. And if you go up, you'll see they already have signs posted. For example, like, again, social distancing, use your own tools, careful how you use your water source, sign in, sign out. You have to be a registered member for the plot to be there. So if you pull it up, there are a significant number of thou shall do, and rightfully so. And I want to give credit to Tracy Park because we opened that yesterday. And in my opinion, they're already implementing all those recommended changes. But if you pull it up, I can send it to you if you don't have it, but it's quite extensive.
So I guess, John, how's this going to be monitored? Is it going to be self-regulated by the group itself, or is the town involved in monitoring this? Because I know that they do have to follow social distancing rules. There can only be 5 people there at one time, other rules and such like that.
Yeah, I spoke to the key gardener groups who organize that, and they understand the limitations, and they're very good about keeping that within their members and do self-monitoring, because the last thing they want is a call to come into the town, or then I make a call to the public health unit, and then they're shut down, because that would be the last thing they would want to happen. So I can assure you from the members I know, they're very, I hate to use the word religious, but they're very religious about following the mandates they've been given, and they understand the latitude.
With May being Sexual Assault Prevention Month, we speak with the Kawartha Sexual Assault Center, and they want you to know you're not alone.
May is Sexual Assault Prevention Month in Canada, and so it's so important that we're letting people know that our supports are there, and that unfortunately we are seeing a huge increase in people accessing our supports, and so it's really important to know of these resources, because unfortunately sexual violence is something that happens in our 4 counties. So we specifically serve Peterborough, City of Kawartha Lakes, Haliburton, and Northumberland, and it's happening here. So knowing of what that local resource is so important when you have a friend that reaches out to you looking for. So our physical office is closed at the moment, but our online texting and phone supports have expanded. So we now have a 24-hour crisis line that you can call. The access to that crisis line has actually gone up 50% since mid-March. So people are accessing that at an increased rate. And we have also opened a texting line, and that has blown up, and we are actually receiving a lot of after-hour texts. So currently the texting line is only open during office hours, but we're having people reach out at 2, 3 o'clock in the morning looking for support or guidance, someone to talk to, etc. So we've really been working hard to get a 24-hour crisis line. That's it's been accepted, but it's all in the process of getting all the behind the scenes worked out to make sure there's someone there 24 hours, making sure we're getting all the technical things worked out as well. So we're really excited to do that. And then we have our online support. So we still have our weekend web chats going, but that we've also added weekday web chats. So during business hours, 9:30 to 4:30, you can go onto our website, and you can access that through our phone as well. And you can connect over our weekend web chat. In terms of our counseling, that has all gone either online, texting, or phone. We've seen that a lot of youth prefer texting versus a phone call or versus like a web chat. So we are very active on social media with everything being shut down. We are amping up our social media support. So whether that's over Facebook at Kawartha Sexual Assault Center, Twitter at Kawartha_SAC, Instagram at Kawartha_SAC, or even TikTok. We have a TikTok account now, which is really it's fun and exciting, but we have a lot of different kinds of supports on there. We have some fun videos mixed with some more grounding videos, mindfulness videos, and as well as our YouTube page. So we kind of have some playlist on there, music to listen to, certain resources for support. Survivortoolkit.ca is also a really great resource. We've had like Biff Naked, we had the Jerry Cans reach out to us, so it's pretty cool, like what a small world. There's been a lot of local support with for our center, understanding that unfortunately it does happen, but as a community we can combat that. We can come together, we can do bystander intervention, we can call out that behavior, we can support people. So we've been really lucky in our community that they've really supported us and welcomed us and understood that this happens, but we are the ones that we can end it.
With churches' revenues down sometimes as high as 70%, we speak with the Roman Catholic Diocese and the All Saints Anglican Church about how this has affected them.
Well, I think we're struggling just like everyone else because, of course, the revenues are down. But, you know, it's really amazing how much people want to support. I've had donations here dropped off at the door, and there are other ways people have chosen to donate. But certainly we're struggling just as everyone else is at this time. The intention of the diocese is to keep everyone on staff, and of course we're relying on the government programs that have come through, and so hopefully we will be able to keep everyone working and well, not working as I mean, because we're not actually having a celebration. I'd say revenues were down between 75 and 80%. That's a rough estimate. I trust in the Lord that we will come out of this, but I think our main concern really can't be money so much to really be concerned of the people, is because the parish is the people. I mean, we have 40 parishes in the diocese, and a lot of those parishes in the north have more than one charge, some of them even 3. And yet at the same time, what makes the parish is the people, not the churches. Our main thing, of course, is gathering in community for the celebration of Eucharist. And sometimes when we can't do that, for our sick and shut in, they've gone to the online or on TV masses, and that's what we're sort of giving to people at this time. I'd like to thank Cogeco Your TV for those masses, because again, those online masses and on TV masses are so important for those who are shut in, which are all of us today.
So much has changed, right? When you can't gather together. Some of it is difficult, especially for people where this is their only community, and they've been coming here decades and decades, right? We have people in their 90s who were baptized in this church. So it's the only place they know to find that kind of comfort. It's very difficult for them. So our reaching out to them has changed. How do we keep them connected? So we've started a prayer ministry where they get a handwritten note from someone. There's telephone calls, right? Who knew that these kinds of low-tech mail and telephone would be our saviors again? Some of our seniors obviously can't get out. They don't drive anymore. And the people who were picking up their groceries are also seniors, so they're not supposed to be out, right? So just managing those kinds of pieces about, does everybody have what they need? It is affecting the church financially, for sure. I mean, some people have their givings automatically removed, and that hasn't changed. In fact, a couple of our parishioners have increased their givings. Some people who put it in the plate every week obviously aren't here, so that money isn't coming in the door as readily as it used to. And of course, we still have bills, right? There's still hydro to pay and insurance to pay, and none of that changes. So it's a balancing act, and we are still paying staff. Every one of our staff is still being paid. We've made that commitment. So yeah, it's a challenge for sure. Our treasurer is looking into that for us. You know, there is a 75% recap of some salaries. So we will be looking into that. It's a complex process though. So we're fortunate enough to have a couple of accountants as treasurers and bookkeepers here. So we're in good shape in that area, but I wonder about other small businesses and churches that don't have that kind of resource.
In all likelihood, the Peterborough Challenger Special Needs Baseball team won't have a season this year. The Jays Care Foundation has, though, stepped up to help the morale of the team. Challenger Baseball Media Liaison Graham Elliott comments on what this means to the organization.
It really builds that morale up and keeps Challenger top of mind for a lot of the players, the families as well. And you know what, sometimes being a parent of a child with special needs sometimes can be a difficult task, not only financially, but emotionally as well. And Jays Care Foundation, as they've always done, has certainly stepped up to the plate in a big way this time around. And basically a care package for the most part for a lot of the families involved in Challenger Baseball. And these things range from gift cards for grocery stores to pick up groceries. Other ways as well as there's a gift card to buy a book. and also some toys and stuff like that, stimulation toys for a lot of these athletes as well, to help them along in their process too. So what you do is you go through a series of different questions. They'll ask you, for example, for a gift card for a book from Indigo, and they'll say, okay, so how would this book utilize or be well utilized by your athlete? And then you can basically describe whether you have a young child that maybe learning how to read, or can maybe utilize a book in a certain way. Maybe they just love books. Maybe they're a big reader and they've read all their books for the last month and a half, so they can get a brand new book, and this will help cover off some of the costs from doing that. Groceries, we all know that grocery costs are certainly going up, and have certainly been a lot more necessary over the last month and a half, with a lot of people staying at home. Their kids maybe eating a lot more at home than maybe they normally would on a Monday to Friday schedule. So again, this can go along for all those families that deal with financial issues, but also, of course, the adaptive equipment kit program. Again, it's about how your child, how your athlete could utilize this kit. And there's everything from squeeze toys in there, a squeeze baseball, little things in there in order to be able to help deal with a number of different things. For example, if your athlete deals with fine motor skill issues, things that we take for granted every single day, which includes, being able to, tie our shoelaces, or be able to throw a ball or hold a ball. These are all things that they can do while they can't be outside playing the sport, but they can still do at home in a safe manner with a lot of these toys, to be able to learn how to be able to throw a ball properly. And that's one of the biggest things that we sometimes forget about with a lot of these athletes, is those little things that we do every single day, struggle with. Tying their shoelaces and being able to handle small things. Doing up their button on their pants sometimes can be a difficult task. So a lot of these accessibility kits that are also part of this package is certainly going to go a long way.
That's the show for today. For Your TV, I'm Dan Malta. We'll see you tomorrow.